The last option for weight loss is one of the newer surgical procedures. However, these surgical procedures are generally recommended in people who have morbid obesity, meaning a BMI that's greater than 40, or if people have a BMI that's greater than 35 and a serious medical disorder, such as diabetes, then this also qualifies for one of the surgical procedures. There are two types of surgical procedures that are done in general. One is called a banding procedure, where a band is placed around the stomach and it's blown up to make the lumen of the stomach much smaller, so people feel full much more quickly, and they become less interested in the food that they're eating. Their appetite gets turned off. The stomach, with time, can expand, and these bands are inflatable, so one can, with an external device, inflate the band to reduce the lumen of the stomach. The second type of procedure which is used is a little bit more invasive, and it involves bypassing the stomach in part of the small intestine. It's more effective than the banding procedure, which can be done under laparoscopic intervention, whereas the bypass procedure requires, of course, anesthesia and a surgical intervention. Now, what about people who do not have morbid obesity, meaning a BMI greater than 40 or a BMI greater than 35 with a serious metabolic associated problem? Well, this is quite controversial at the present time, and although such bypass surgery or banding procedures are not recommended in individuals with a BMI less than 35, this is being done in some patients, and this is something that really would need to be discussed with your physician in terms of what are the risks and benefits in people with BMIs that are less than 35.